Hello friends. So today I am going to be talking about a very important aspect of healing, and the first step that every homeopathic physician and the patient meeting the homeopathic physician must know about. So I am going to be talking about case taking and case history of an individual by the homeopathic physician, and how it is not only beneficial to the homeopathic physician but also very beneficial to the patient. So I am Dr. Komal Gandhi, consulting homeopath, consulting nutritionist, and I have been practicing for more than 15 years, and I thought this information is very important, which needs to be conveyed to not only students of homeopathy or not only the homeopathic physicians, but also to the people who are consulting homeopaths for healing their diseases, right? So a case that is well taken is half cured. It's a very nice saying that we used to study during our study days, right? And it holds so true. So what we do in homeopathy is we are trying to collect all the possible data from the patient and then match it to the right remedy that can help the patient cure himself or herself. Okay. So first and foremost, we try and understand the chief complaint of the patient as to what the patient is suffering from. So for instance, the patient may say that, doctor, I am having a headache. Okay, so headache is a symptom, and then we try and understand as to, what is the headache like, where is the headache, why has the headache started. So we may ask questions like, okay, so where do you feel your head pains the most? Some may say that their vertex is paining, some may say their occipital region is paining, some may say we are having a pain over here, or just one sided pain, right? So every person is unique and will have a unique set of symptoms, and we are trying to understand what exactly is troubling the patient. Okay. Besides that, we will try and understand what are the factors that are triggering the headache or aggravating it, and what does the patient feel better by, temporary though. Yes. Along with it, why has the headache started? Sometimes there is some causative modality, maybe the patient has kind of had some lot of stress at work and the headache has started, or the patient is suffering from indigestion since 2-3 days and all of a sudden the headache has come up now. So there are different ways in which the symptoms will be presenting, and we are trying to understand the exact nature of the disease, right? Now besides this, we also try and see, besides the onset of the disease, what is the duration for which it lasts and the progress of it. This helps us in disease diagnosis, as well as helps us to understand the intensity of pain that is felt by the patient. After this, we take into consideration the past history, family history, also the physical generals of a patient as to how is the appetite of the patient, thirst, cravings, aversions. Does the patient feel hot very easily or cold very easily? These are all physical generals. Do they have motion sickness, or do they like to cover themselves up at night? These are minute details that we take into consideration while prescribing the right remedy. Okay. So along with this, we also try and examine the mind and the mental state of the patient. Okay. Now here, very interestingly, you must note this, that when the homeopathic physician is asking you all these questions, his or her prime intention is to find the right remedy for you and to understand you in totality, so that we can prescribe the right remedy that can bring about lasting cures and quick cures. Okay, it is a non-judgmental place. I will repeat this. When you're with your homeopathic physician, it is an absolutely non-judgmental space where you are free to talk about yourself, about what you feel, about small things that are bothering you, because here the only intention, the prime and only mission of the homeopathic physician is to cure in a gentle and a harmonious way, right? So remember, next time when you visit the homeopathic doctor, freely share all that you want to share with the patient, with the physician. Okay, we believe every person is unique, and we believe in the theory of individualization, right? Every person is different in health and different in disease as well. Okay, and that's why one remedy that may suit a person with headache may not suit the other person with a similar kind of headache. Okay, so one man's meat can be another man's poison. So if somebody is maybe suffering from cough, but feels better in open air, the remedy is different. And we have another patient who's again suffering from the same type of cough, but feels better in closed rooms, and the remedy changes, right? I hope I was able to explain to you the need for a detailed case taking, and also what we've seen sometimes just during the case taking, especially in chronic diseases. Okay, when the patient is talking about themselves and about their life history, they may also get a little emotional, they may weep during that time, but a lot of healing also takes place when the patient is sharing what they are going through, right? So it is very what do you call, beneficial for the patient as well, the whole case taking process. It is a dynamic interaction between the physician and the patient, and the final aim is to help the patient heal. So I'm Dr. Komal Gandhi, consulting homeopath, consulting nutritionist, and I will see you soon next week with another topic on health and wellness. Thank you.